Good day, everyone. I'm Dr. Hu from the University of Johannesburg. In this video, we are going to discuss how to study Chinese medicine. Firstly, I would like to introduce some learning theories. Miller's pyramid is well known in education. In order to action or in order to do something, firstly, we need to be able to know, we need to have the knowledge, and then we need to be competent, and then only after that we can perform and take actions. So from the pyramids, you can see the nodes and those how are the foundations. Also, according to revised Bloom's taxonomy, in order to create something, that's the final phase of learning, you need to have the foundation. The foundation refers to the knowledge, comprehension, the application, analysis, synthesis, and then eventually evaluation. In other simpler words, refer to remembering. You need to remember the contents, you need to understand the content knowledge, and then only after these two foundations, you'll be able to apply and analyze, and then afterwards you can evaluate and create. So let's use Chinese medicine as an example. When creating, we actually refer to when you see patients, you can prescribe a prescription. No matter the prescription is prescribed by yourself or you use the previous prescriptions from the medical works, but that's creating, because you're actually you're creating a prescription according to the current situation. But in order to achieve this level, you still need to have the content knowledge. You need to understand, you need to remember, and then you need to understand. Many students think that you need to understand first and then afterwards you can remember. But from the revised Bloom's taxonomy, we actually require you should remember first and then understand. These two steps sometimes happen simultaneously, but sometimes it does happen that you need to remember the content first, and then after a while, then you can understand. So remember, you can use some words. For example, if you can recall the content knowledge, or you can recognize, you can identify the information that's these are included in remember. Understand, you can interpret, you can explain. Furthermore, you need to apply, you need to analyze, and then evaluate. So these are the learning theories. That's what are the foundations of learning. Also, according to Gardner's multiple intelligence, individuals, we have different habits or preference in learning. For example, for myself, I prefer reading. I prefer visualize, to see the words. After reading, I memorize better. But some other students, they may prefer discussion. They may prefer listen to my lectures. And from hearing, they understand better, they remember better. Or some other students, they may prefer group study. While the other students, some others even they are more practical. When they see something, the practical activities, they can remember, they can learn better, they can remember better. So to introduce these, actually, I would like everyone to reflect on themselves, which style works for you, in which type of learning you have the most efficient results, so then you can apply those more. The last information I would like to share with you is the forgetting curve in the learning theory. Forgetting curve is the psychological process that's applied to everyone. This refers to when we learn new information, the process of forgetting is actually we forget quicker at the first few hours, and then the way of forgetting is becomes slower. So you can see if we remember the content knowledge 100% after 1 hour, we actually will forget almost 50% of the content knowledge if you don't revise. And afterwards, the way how we forget information becomes slower. That's why we actually recommend that if we remember 100%, and then we recommend you to revise after 1 day and after certain days. This should overcome the forgetting curve. And this, if you work in this way, the knowledge retention will be more efficient. So for example, why we start at 80%, the reason is because no one can remember 100% of the information in a lecture, but rather you will remember 80%, and then in the first 10 minutes you're going to forget, and then in the first 24 hours, if you don't revise, then you're going to only remember even less than 50%. So what we recommend you to do is, after 24 hours, immediately after the class, 30 minutes after class, immediately after 12 hours after class on the same day, you're going to revise the content knowledge. For the same content knowledge, you're going to revise after 1 day. For example, tomorrow, you're going to revise the same content knowledge, and then after 1 week, you're also going to revise. So that's how to overcome the forgetting curve. If you apply this in your learning, your study will be more efficient, and you also will be able to retain more knowledge in yourself. So we actually, for the same content knowledge, we actually require you to revise 4 to 5 times. And after 4 to 5 times, you will remember much better. So these are the illustrations of forgetting curve. In this page, I would like to give you some example of the actual application of forgetting curve. So this is a 21 days revision plan. The image may be slightly small, but I will explain in detail. For example, day 1, for example, here, day 1, the content knowledge, the day 1's content knowledge, you're going to revise, you're going to study first, you're going to revise in 30 minutes, you're going to revise again in 12 hours. So the green parts you can see is actually in 1 day. So sometimes you can't revise in 30 minutes. The reason is because our lectures sometimes already have 50 minutes or 45 minutes. So the more practical way is you're going to revise after 12 hours, which means if we have lecture today, this evening you're going to revise again for the same content. And then day 2, for example, tomorrow, you're going to study the new content, but in the meantime, you're going to revise the content that you studied today. So from day 1, you study the new content for day 2, but in the meantime, you revise day 1 information. On day 3, you study new contents as well. For day 3, you revise day 2 and day 1 information. On the 4th day, you're going to study the new content for the 4th days, and then you're going to revise day 2 and day 3 contents on different days, on the same day. And then on the 5th day, you're going to study the new content for the 5th day, and then revise day 4, day 3, and day 1. So you can search on Google to try to see the 21 days revision plan. But sometimes students may confuse that, do I accumulate more and more and I spend too much time in study? The answer is no. The reason is because when you see this revision plan, on day 14 or day 15, you will see after day 15, the amount of the time you spend becomes stable. So it doesn't mean you need to spend more and more time on your study, but rather you're going to revise smartly and more efficiently. If you use this type of habits, revision plan, you should retain more knowledge with the same time, so that your study will be more efficient. What is expected of you? So firstly, the personal accountability. Personal accountability will actually require you firstly to remember the content knowledge. That's also from the revised Bloom's taxonomy. You need to remember, understand, and then you need to manage the time efficiently. So here I recommend forgetting curve. For the efficient time management, we also recommends practice. To be competent in Chinese medicine, practice cannot, the importance of practice cannot be overemphasized. I always said no excellence can be acquired without constant practice. So we actually encourage you to participate in clinic to increase your clinical exposure as much as possible. For instance, even at the beginning of your study, in the first year of your study, we still recommend you to attend clinic, at least to observe. You will make more sense of the content knowledge, and you also will be familiar how to apply this knowledge into daily practice. And as the year goes on, more and more cases you observed, then you'll be more familiar to the content knowledge. Your critical thinking also will be much more flexible and much more accurate. So these are some tips on learning Chinese medicine.